Well, it's not, and that's a huge headache for the Biden administration, the fact that it is not evenly distributed, and those places with the highest rate of infections are the places that people are most likely to have refused to get the virus. So it's almost an overlay. If you overlay the counties that voted for Donald Trump and the counties that voted for Joe Biden, they have starkly different rates of COVID infections, and the ones that voted for Donald Trump have higher rates of Delta variant infections than they do in other places.
This was always supposed to be a multi-pronged approach to getting this under control. And aside from vaccinations, we know that children are not vaccinated. The start of the school year might be affecting some of these numbers. One of the other prongs was always supposed to be testing. Are we seeing enough testing, rapid and frequent testing, of children that are going to schools and possibly getting infected and then affecting people back home with breakthrough infections?
Well, here again, you identify another problem. COVID policy has been all over the map. And because it's been so heavily politicized, you have states that don't even want to require children to wear masks when they go to school. They have in turn difficulty testing all those children who go to school, and there aren't any solid policies in place for that either. So it's been really difficult to get a grip on this problem with so many variables, with the science going back and forth between more vaccinations, less vaccinations, more tests, fewer tests, and all of this confusion. I mean, the Biden administration said they were going to follow the science, but the science has kind of led them in a bit of a spiral to where we can't really get a clear, coherent message to refute not only vaccine skeptics, but governors who don't want children to wear masks in schools.
So the country of Israel was seen largely as a guinea pig for much of this because of an early deal it made with Pfizer, allowing it access to vaccines early on, back as early as December. They're already in a phase of boosters. They started boosters over the summer, and they saw it as very effective, bringing their wave quickly back down. Dr. Fauci earlier over the summer was for boosters. Now the FDA has cautioned against it, and it seems that the timing that it followed a plea by the WHO not to introduce boosters while much of the world still hasn't had its first shot. Do you think some of this is really following the science, or is it responding to political pressure?
Well, I think it's responding to political science, if you will. The science is supposed to lead the way, but politics are very influential here. We just talked about that in terms of states and areas that aren't vaccinated, but seeing highly spiking routines. I think Fauci might have gotten ahead of the skis, and so did the Biden administration, because Israel does not have the same sort of political problems that we do, particularly when it comes around health policy, vaccinations, and what needs to be done to get the vaccine under control. We have a lot of areas of this country that feel like any mandate from the government, no matter how much it's supposed to keep them and everyone else around them safe, is bad policy and bad politics. They're fighting against it tooth and nail. And because the country is so split, Biden's margin of error here is very, very small.